Hello, everyone. I am Dr. Satish Ramalingam from SRM Institute of Science and Technology. I am a cancer biologist for over 17 years now. In this video, I'll be briefly introducing about cancer. Before we get to know what is cancer, we should know about the cells in our body. So, our body is made up of trillions of cells. The cells group to make up tissue and organs. So, there are 230 different types of cells in your body. And then, when the cells become damaged or worn out, as they die, the body makes new cells to replace them. And this process is called cell division. Some cells in your body divide very fast, like the cells in the blood, the red blood cells which carry oxygen when we breathe. There are 2 millions of cells that we produce per second, actually. In intestine, the intestinal epithelial cells, we give rise to 200 grams of tissue every day. So that's the recycling potential of these cells. There are some cells in your body which divide when there is a need. Like, for example, when the liver gets damaged, the hepatocytes, if they are only 40% present, they can give rise to the whole 100% again. There are some other types of cells in your body, like the neurons in your brain. So these cells won't divide at all. So whatever number of neurons you have at the time of birth, we still stay with the same. So these are the ability of the cell, and then the cells know when to divide and then like when to stop the division. Whereas in the cancer, there is an abnormal cell which divide in an uncontrollable manner, that is called cancer. When the cells become abnormal and then they started to divide and grow in size locally, they're called tumor. And then like they cannot spread to different organs, and they are covered by a capsule. These are called benign tumor. So benign tumor is harmless usually, unless like if it is compressing a nerve or something, then there may be a problem. So whereas when this abnormal cells, when it divides uncontrollably and then spreads through other organs through the blood or lymphatic vessels, it is called malignant tumor. So this is dangerous. This has its own effect on our body. So how does cancer affect us? Cancer is the second leading cause of death worldwide, next to the cardiovascular diseases. And cancer has already emerged as a leading cause of death in many US states. So if you take the global statistics, there are 15.2 million cases by the year 2015. And then by the year 2021, it has increased to 19.3 million. And then it is expected to even go higher to 24 million by the year of 2035. And then if you take the cancer death, like by 2015, it was 8.8 million deaths. And then like in 2021, there were 10 million deaths. And it is expected to go to 14.6 million by the year 2035. So if you take the Indian statistics, there are 45 lakh cancer patients in India, and then there are 15 lakh new cases every year, and then 7.5 lakhs Indians die each year due to cancer. So that's why it is important for us to understand about cancer and then find ways to treat it. So there are some good news too. Like for example, 40% of the cancer is caused by tobacco use. So if you prevent that, we can prevent 40% of the people suffering from cancer. And then there are 12 to 20 percentage of cancer caused by tumor viruses. And then if we have developed proper vaccination, and then if you're taken proper vaccination, we could prevent that 20% of the cancer too. So another good news is that like the healthy body has immune system that can fight against newly formed cancer cells, and then it eliminates the cancer cells in your body. Every day in our body, there are new cancer cells that are produced, but we don't get cancer because of these immune cells, thanks to the immune system. So we all know that cancer has been around many years. It has even affected dinosaurs and the ancient Egyptians, as evident from the fossils and then mummies. So, how do we get it? So, based on the research over the years, we have identified certain risk factors for the development of cancer. To start with, let us see about aging. Cancer can be considered an age related disease because the incidence of most cancer increases with the age. So, only 1.7% of all cancer related death in both the sexes occur before the age of 40 years. So 90% of the cancers are diagnosed in those aged greater than 50 years. So age is an important factor. And next is the family history. So 10% of the cancer is called familial cancer as it runs through the family. So it's not the cancer that is formed. The cells with the defective genes are passed to the next generation. So if you might have heard about Angelina Jolie, who is a Hollywood actress. Her mother had cancer, and then her grandmother had cancer. Her grandmother had cancer. So they all had cancer because they have been passing this disease causing gene through the next generation. So she has performed preventive surgical removal of her breasts and ovaries, and then that has significantly decreased her risk of getting ovarian cancer or breast cancer. So next is the physical inactivity. So you have to move more and sit less to have a healthy body because that's been connected that like if there is less physical activity, then they get uh, there is an increased cancer risk, and also the unhealthy diet. So consumption of processed and red meats can cause cancer. So it has been shown scientifically. So radiation exposure, people who get exposed to UV radiation, like in Arizona in United States, people get skin cancer and the cases are high. That's because of the UV exposure they get from the sun. So there are radon in some of the basements regions or some regions in general, so which have been connected with the cancer risk too. So next is alcohol. So alcohol and smoking, they both have been well connected uh, to get cancer. Like I told in the previous slide, to 40% of the cancer is because of the tobacco usage, and then like alcohol is being connected with the several types of cancer too. So next is obesity. So uh, healthy diet, uh, physical inactivity, all leads to unhealthy diet, and the physical inactivity all leads to obesity. And then obesity has been connected with many diseases uh, like diabetes and cardiovascular diseases, and it has been associated with cancer too. So viruses like HPV, Epstein-Barr viruses, there are several types of viruses that are shown to cause cancer. And then bacteria has been shown to cause cancer too, like the stomach has Helicobacter pylori, which Dr. Barry Marshall has shown that the presence of Helicobacter pylori in the stomach can cause ulcer, and then this ulcer can lead to cancer formation. So next comes the reproductive factors, uh, like early onset of menstruation, or late onset of menopause, or later age at first pregnancy, and never having given birth, all have been shown to have increased risk of cancer. Conversely, pregnancy and breastfeeding, which both reduce the risk of cancer. So finally comes this occupational exposure. So people who work in asbestos industries, they get more cancer. And then like people exposed to welding fumes, they get more cancer, lung cancer and other types of cancer too. So these are the risk factors, common risk factors associated with cancer. Cancer can be broadly grouped into different types depending upon which tissue they come from. So they are classified into carcinoma, sarcoma, leukemia, lymphoma, and melanoma. So here in this slide, we are going to see about carcinoma. So the most common type of cancer arises from the cells that cover external and internal body surfaces. So there is a subtype of this carcinoma called adenocarcinoma, which forms in glandular epithelial cells, which secrete mucus, digestive juices, and other fluids. These types of cancers are typically solid tumors. Basically, lung, breast, and colon are the most frequent cancers of this type. Sarcomas are cancers arising from cells found in the supporting tissue of the body, such as bone, cartilage, fat, connective tissue, and muscle. So osteosarcoma is the most common cancer of bone. So if it is happening in fat cells, it's called liposarcoma. If it is happening in cartilage, it's called chondrosarcoma. In general, sarcomas are the group of rare cancers. Leukemia are cancers of the immature blood cells that grow in the bone marrow and tend to accumulate in large numbers in the bloodstream. There are four common types of leukemia, which are grouped based on how quickly the disease gets worse, like whether it's acute or chronic, and on the type of blood cells the cancer starts in, whether it's lymphoblastic or myeloid. Whereas lymphomas are cancers that arise in the lymph nodes and tissues of the body's immune system. So these arise from the cancer, the immune cells too. However, these are solid cancers because they happen in the lymph node. Multiple myeloma is a cancer that forms in the type of white blood cell which produces antibody against the foreign antigen, and these cells are called plasma cells. So accumulation of more plasma cell in the bone marrow is myeloma. So next comes the brain and the spinal cord cancers. So these tumors develop from the glial cells, which are supporting cells that surrounds the neuron in the brain, including the astrocytes and the oligodendrocytes. So these cells can divide and give rise to more cells, unlike neurons, which will not divide. Melanoma is a form of skin cancer that begins in the cells that are called melanocytes that control the pigment in your skin. The malignant melanoma spreads faster and then it's very dangerous. 90% of cancer related death is because of metastasis. And then metastasis progression of solid cancer can be divided into five major steps. So here I'm going to show you an example of colon cancer to understand how cancer progresses and then moves from one place to another. So if you see, this is a epithelium lining of epithelial cells, and then these cells they start dividing uncontrollably and then start invading the neighboring tissues such as connective tissues like muscularis mucosa, and then in this stage it's called stage 1 cancer. When it uh, when it reaches until muscularis propria, it is called stage 2. And then if they identify these cancers in these early stages, we can remove it surgically, and then these patients can be saved. However, if the cancer moves further and then reaches a blood vessel or lymph nodes, so these started entering into the circulatory system, so which can take these cancer cells to different sites like lung, liver, and bone. So based on this, there are five major steps of metastasis is defined. One is invasion of the basement membrane and the cell migration. From here, they go through the basement membrane. Intravasation into the surrounding vasculature or lymphatic system. So these tumor, they try to enter the blood vessel or lymphatic vessels. Survival in the circulation. So once they enter into the circulatory system, they have to survive against the circulating immune cells. Then third one is extravasation from the vasculature to the secondary tissue. So they have to go from the blood vessel to the different organs. And then the final step is colonizing the organ like lung, liver, or bone. So cancer staging is based on the anatomical extent of the disease. As I said earlier, stage 1, the tumor that is limited to the mucosal layer T1 or muscularis propria. So muscular, if it is reached till muscularis propria, it's stage 2. If it is staying till like muscularis mucosa, it's called stage 1. So these two stages, they are shown like more than 80% of success rate in the treatment. So because they don't involve any lymph node or distant metastatic organs. So stage 3 tumors, they invade the nearby structures like lymph nodes and blood vessel. So if it has reached 2 to 3 lymph nodes, they are called stage 3. And then if those If the number of lymph nodes increases to 6, and then if it has entered the different organs, it's called stage 4. So as the stage increases, it will be hard for the treatment. So this staging is called TNM staging. T stands for the tumor size, N stands for the nodes, M stands for the metastatic organs, the site where. So cancer treatment options. So as soon as somebody is diagnosed with cancer, the first option the clinician has is to surgically remove the tumor out. So it doesn't matter which stage they are in. Like surgical removal is always recommended because you are chopping the tumor out so that there is no tumor that is growing, hoping that we are not left any piece of tumor that is left inside your body. Anyhow, to be in safer side, the second option is the chemotherapeutic option, where they will give the drugs that will inhibit the fast dividing cells, and even if there are some cells left in your body, they will be prevented from dividing. So next treatment option is radiation therapy. So they will pass radiation to those cancer site of the tumor, and then like those cells will be divided, will be stopped from dividing too. So these are the top three options. And then recent technologies like bone marrow transplant, when there is a blood cancer formed. So you irradiate the patient, you remove all the hematopoietic stem cells, which give rise to all the cells that are there in the blood, and then you transplant a healthy bone marrow, and then the cells that come from there will have the control in the cell division. So you won't have any uh, blood cancer in them. So the next option is immunotherapy, where you can develop antibody against the tumor cells so that even if the body immune system could not catch it, so these antibodies can target the cancer cells and then kill them and wipe it off. So the last one is the gene therapy, which is going to be the future of all the therapy, where we can add a specific gene to kill the cancer cells, or add a specific gene to activate the prodrug into an active drug, or you can remove a gene which makes the cell to divide continuously. So these are still under clinical trial, so which will have a huge impact in the future cancer treatment options. That's it for this video. Hope this video has spread some awareness about cancer. Thanks for watching.